The following is a short lesson overviewing the models for the respiratory system practical. So this is a sagittal head model that we use where we have everything labeled for the nasal cavity. So kind of starting above, this is the frontal sinus, right? Remember, sinuses are important in moisturizing air as it comes through the nasal cavity. This is the cribriform plate. This is of the ethmoid bone, kind of forms the ceiling of the nasal cavity. This here is in the body of the sphenoid bone. This is the sphenoid or the sphenoidal sinus, right? This is the second sinus that we have on this model. Inside the nasal cavity, you're going to see three nasal concha: the superior, the middle, and the inferior nasal concha. The superior and the middle are actually part of the ethmoid bone, and then this is a facial bone. You should be able to identify those. Between the three concha are three narrow tubes. One, two, three. These are the meatises. And meatis is a kind of like an entrance to a canal. So it's also showing a canal right here. So the air is going to flow through the meatus. Superior meatus, middle meatus, inferior meatus. Now, the nostril is known as the external nair. Once the air goes through the nostril or the external nair, it's going to go to this region right here. This is the vestibule. Okay. This moves down a little bit. Remember that the pharynx is shared by both the respiratory system as well as the digestive system. So this is showing the three regions of the pharynx. But the very last part of the nasal cavity, this kind of area right here, this would be the internal nares, which they now call the conae. I'm not sure how your lecture teachers talk about it, but I'm going to refer to it as the internal nair. This kind of represents the ending point of the nasal cavity. Now, the nasopharynx extends from the internal nair to the uvula, this little lower part of the soft palate right here. This is the soft palate. This lower part right here is the uvula. So from the uvula to the internal nares, this is the nasopharynx. Okay. Inside the nasopharynx, we have the opening to the auditory tube or the eustachian tube. This is the one that goes to the middle ear. Then from the uvula to the epiglottis right here, this is the epiglottis, this structure. So to the top of the epiglottis, this would be the oropharynx. And then from the epiglottis down to where the esophagus begins or the larynx begins, this is going to be called the laryngopharynx. Okay, so nasopharynx above, oropharynx, laryngopharynx. Right, we can see here's the hard palate forming the floor of the nasal cavity. This would be the soft palate, right? And that little punching bag at the bottom of the soft palate, when you look in somebody's mouth, that is the uvula. Also in the nasopharynx, I have it labeled on this slide. This little piece of tissue right here is the pharyngeal tonsil, also known as the adenoid. Right, so again, here's the auditory tube opening. Here's the adenoid. Right, on this one, I have the hard palate labeled, soft palate, uvula. Also in the oropharynx, we have the palatine tonsils. These are the ones that are most commonly removed when somebody has a tonsillectomy. They're on the kind of like the side walls of the pharynx. They maybe look like a walnut, that type of thing. And then on the bottom of the tongue is the lingual tonsil. So it's another tonsil. Here is the tongue. Here is the oral cavity, right? We can breathe through our mouth, so we could consider that part of the respiratory system. In front of the teeth, but behind the lips, this little space right here is the vestibule. Now moving down a little bit further, so this is kind of more in the larynx area. So this whole structure here would be the epiglottis, right? This is just some of the cartilage of it, but this whole tissue right here would be the epiglottis. In front of it, we can see the tip of the, or the front, the body of the hyoid bone. Here's the thyroid cartilage. Again, we see the thyroid cartilage in the front. We don't see it in the back because it doesn't close in the back. But down here, right here, this is the cricoid cartilage, and then this is also the cricoid cartilage. Now, if you remember from the lab, we said that the cricoid cartilage circles the entire larynx, so we see it in the back also. And also notice in the back it is taller than in the front. So this opening right here is the glottis. This is where air is going to come down into the down through the larynx. Above it we have the false vocal cord or the vestibular fold. Below it, this is the true vocal cord or the vocal fold. Both answers would be correct. Here's the esophagus right here. So we can see the esophagus is posterior to the trachea. Okay, the second model I want to cover, this is what I call the larynx in the blue box, because usually they're stored in a blue box over at NASA, so that's the way I label it. So we're here, we have a front view of some of the structures I'd like you to know for this larynx model. Here's the hyoid bone, and then below it would be the actual thyroid cartilage. You can see here there is a ligament that connects the thyroid cartilage to the hyoid bone. We call it the thyrohyoid ligament. Hey, you don't have to know this muscle over here, the thyrohyoid muscle. Don't worry about that. But here's your thyroid cartilage, right, forming the front and side walls of the larynx. The prominence in the front would be the Adam's apple. That is your laryngeal prominence, right? And here's a picture of the thyroid gland itself. And then this would be the actual tracheal cartilage here, the rings of the trachea. Now, if I turn the model around, we get a little bit of a different view. Here's the hyoid bone from the back. This is a good picture of the epiglottis right here. So this is the whole epiglottis. Here we see the thyroid cartilage from the back. Right, remember, it only forms the side wall, so we're seeing the posterior edge of the side wall. Same thing here. Then here's your cricoid cartilage in the back right here. Again, you can ignore all these muscles. I didn't label them, but this would be the cricoid cartilage. And we see a little bit of the arytenoid cartilage and the little beak on it, which is the corniculate. Now, in the lab, I told you not to worry about it. I forgot we had this model here, but this is one of the cartilages that are actually in the vocal fold called the corniculate cartilage. I won't ask you it on the practical, but I just wanted to show you that it is there. It is one of the cartilages that we do see on this model. That's not going to be on the next model I'm going to show you, but we do see the arytenoid and the corniculate. One of the main models that we use is the I call this the gray larynx. This is a nice size model. We see some of the same structures. You can see the hyoid bone, your thyroid cartilage right here. The prominence in the front is the laryngeal prominence or the Adam's apple. And then here's the membrane, again, connecting the thyroid to the hyoid bone. We call it the thyrohyoid ligament. Okay, out here is the lateral part, here is the median part. Down over here is your cricoid cartilage. And then there's a membrane also connecting, we call this the cricothyroid ligament, and we name it from the bottom up. Then from the cricoid cartilage down to the first tracheal ring right here, we actually call this membrane the cricotracheal ligament. From this one we name from the top down. Each one of these here are going to be the tracheal cartilages, and then in between there's something known as the annular ligaments. These are the ligaments connecting the tracheal cartilages. And again, you can see here the thyroid gland. Now, when we turn this larynx around from behind, we can see nicely again the epiglottis, right? The back of the hyoid bone over here. This is the back of the thyroid cartilage on the right. Now, this here would all be the arytenoid cartilage. I labeled it here. And again, the little cartilage that's like a beak right there is the corniculate. Here's your cricoid cartilage from behind. Remember, the cricoid does close up the larynx, and it's taller in the back than it is in the front. Right, in the front it's small, short, I should say. Right, it's not very tall, but in the back it's much bigger. So it's a good way to differentiate it. Here's your again your thyroid gland. Then, if you remember from the endocrine system, here's your parathyroids right there. Now, this is the posterior membrane of the trachea. right there. And then if you remember, there's a smooth muscle on there. This is the trachealis muscle that closes up the cartilaginous ring. If you remember, the cartilaginous ring is not closed up here or here, so there's muscle and elastic tissue closing up the posterior aspect. The third model we have includes, again, the larynx up top. So some of the landmarks we can see here: hyoid, thyroid cartilage, again, laryngeal prominence would be here, cricoid cartilage. But what I like about this model, this shows the entire trachea. So we can see all the tracheal rings, we can see the annular ligaments. The end of the trachea ends as the carina, so the splitting point would be the carina, and then we have here the left primary bronchus, and then this would be the right primary bronchus. We can see some of the secondary bronchi on this picture. Here would be a secondary bronchus on the right. There's a third one too, we really can't see it. And then there's the two secondary on the left. Remember, the secondary bronchi go to each lobe. And then all of the colored ones are the tertiary bronchi. Right? Those are the ones that go into the actual segments of the lung. We call them bronchopulmonary segments. Now, if I turn this model around, again, you can see the bronchi a little bit better. Right here would be the left primary bronchus from behind. Here would be the right primary bronchus from behind. And then you can see here's the posterior membrane of the trachea. We don't really see the trachealis, but if you put trachealis, if I asked you what this was, and if you put the trachealis, I would be okay with that, because that's what's actually there. They're just not showing it. Right here, you can see some of the other laryngeal structures: the arytenoid, the corniculate, the epiglottis, cricoid. Okay, this is the diaphragm, so this is the main muscle of breathing. We also went over this on the blood vessel part. Here's your inferior phrenic artery and vein, and then if we turn it around, superior phrenic artery right here. They don't show the superior phrenic vein. The yellow one, I'm not going to ask this, but that would be the phrenic nerve. This is an FYI, I'm not going to ask you this either, but there are some big openings in the diaphragm. This one here is for the esophagus to go down to the stomach. This is where your aorta would run, and then your inferior vena cava would go through this. This is more of an FYI, for your information only. So this is the lung model. We can see here again, this would be the left lung. Notice the left lung has two lobes, superior and inferior, and the reason for that, it only has one fissure right there. One fissure. That is the oblique fissure. This would be, again, the superior lobe. This would be the inferior lobe. And then in the left lung, there's the cardiac notch. On the right lung, you have a superior lobe, a middle lobe, and then here's the inferior lobe. The reason for that is you have an oblique fissure right there, as well as a horizontal fissure. The bottom of the lung is the base. The top part is the apex. So if we take these two parts of the lung off, the hilum here would be the entrance of the arteries and veins and the tubes into the left lung, and then here's the hilum on the right. Okay, so coming down here, it looks a little bit intimidating. It's not that bad. Watch this. Trachea ends at the carina. Left primary bronchus brings the air to the lung. Right primary bronchus brings the air to the lung. Then there's two secondary bronchi on the left, because there's two lobes. So these are your left secondary bronchi. And then all of these here, the blue ones out here, right, they're uncut. These are the tertiary bronchi on the left. Same thing on the right. From the primary bronchus here, 1, 2, 3 secondary bronchi. Why? Because there's 3 lobes. And then here, these are the tertiary bronchi, but on this side, they've cut into them. That's why they look a little bit different than on the left. Here's your esophagus. Right, this would be your thoracic aorta right over here. I didn't label it, but we would know that already. So here are the arteries and veins inside the lungs. The blue ones are the pulmonary arteries, right? They're bringing the blood from the heart to the lungs for oxygenation, and then the red ones are bringing the blood back to the heart. These are the pulmonary veins bringing oxygenated blood back to the heart. So remember, arteries and veins, their colors are always reversed inside of the lung. They're always going to the colors are going to be reversed. Okay, we have the base here, the apex. I think we got most everything. So this is the brown torso, again showing some of the main structures. The right lung, we can see again, this would be the apex. Pulmonary arteries, again, are going to always be blue. Pulmonary veins. This is the diaphragm muscle over here. This is the pleura, right? The pleura would be the lining around the pleural cavity. So that would be this blue membrane right over here, and it would be the same membrane that's on the lung. That would be the visceral pleura, right? So this would be the parietal pleura, since it's on the wall of the cavity. This is the large male muscle model. Same thing, you can see the pleura here lining the cavity, so this would be the parietal pleura. We see some of the bronchi. Again, this would be the right primary bronchus, left primary bronchus, and then you can see two of the secondary bronchi. And then we're just showing the left lung over here. Again, just a blow up, same thing. Trachea, right primary bronchus, carina is the splitting point, left primary bronchus, and then your two secondary bronchi. This is the pink torso that we have on our lab tables. Again, just kind of some of the same highlights here. We can see the right lung superior lobe. We can catch some of the oblique fissure here. I'm sorry, I said the right lung. This is the left lung, obviously. He's facing us. Left lung, oblique fissure. Inferior lobe. Here's your right lung cut, superior, middle, and inferior lobes. We can see the horizontal fissure. Right, and then the oblique fissure on this cut, even though it doesn't look oblique on this one, but this would be the oblique fissure. Here we can see the larynx, the trachea. Again, looking at the tubes, carina, left primary bronchus, and then 1, 2 secondary bronchi. And you always want to count make sure how many lobes there are, and they correspond to the secondary bronchi. And then over here are your 3, 1, 2, 3 secondary bronchi on the right. Right, carina would be in the middle here. Same picture, just again, just a little bit further back. Now we could also see the tertiary bronchi. I think we got most everything on there. This was just a blow up before. This was a blow up, and we're a little bit further away. The only thing that's different from the previous slide is that we could see the tertiary bronchi. And I think that covers most everything for the respiratory portion of the practical.